Hi, this is Dana with Domino Effect Financial, and thank you for reaching out to us for your personalized offering on easy quoting for health insurance. So this is an example of a family that lives in Tennessee. You'll notice we did ask what county you're in. If you happen to be in a county that a zip code has more than one, we will need to know. So this particular family is in Christian County. We have 4 people in the household. You'll notice that we just do it by age. There's nothing that is denoting you as the individual receiving this quote. So no private information is going to be shared in this quote. Their best guess for the year, this is being recorded in the year 2025, is $72,000. We are going to be able to show you the lowest plans, but lowest plans are not always the best, but we do have all of the plans available on an ACA marketplace that are available in that location. And let's say that person was making more than $72,000 and they were making $172,000. They still qualify for a subsidy. We'll be able to show you that. And what happens if they make more than that and they don't have subsidies? Our quotes will be able to share with you what the full price would be, and then we would also be looking at private carriers that offer better benefits with lower or similar rates. So that's one way that we're going to be able to help you, but let's go ahead and keep with that $72,000. And again, the lowest is not always the best. This means your deductible, $7,550, is how much you need to start spending before the insurance kicks in with their percentage share of cost. This family is qualifying for what we call a cost sharing reduction that only happens on a silver plan. So we're going to jump on over there and watch these prices on the max out of pocket drop down. Our deductibles are also going to be dropping down. We're going to be able to look at doctor visits, specialists. We can look deeper into the plan and find out what else is going to be covered. And even more than that, we'll be able to do comparison shopping. So let's go ahead and go back on this family, take away that silver, and say they do want a $0 premium plan. That's how much are you spending each month. This red is showing you what the cost would be without those subsidies. And I don't like things that say no charge after deductible. So we are going to put that one into the mix. And let's do this one. Everybody knows Anthem in that area, so let's put that into the mix. But now let's go ahead and mark our silver. Again, this is what I do in your personalized plan. And from the video, you're going to see everything in real time so that you're knowing that you get exactly what I am sharing with you. So what I'm looking now is going to be lowest max out of pocket. Want to stay within a nice budget, keep a low deductible, and have co-pays from the very beginning. So in this situation, we're only going to compare 3. Sometimes I will compare more than that. You'll be able to see the 3 plans that we are looking at. Definitely there's a price difference, but what I want to point out, how much do you need to spend before your share of before the insurance starts paying their share of cost? Significantly lower here. Most people never reach that deductible, so many people will want to be in this, but there are catches on that. If you need help for medical events, just know you will be responsible for that first $7,700 or $7,500 versus the $3,500. But again, that monthly budget, this number right here, this is money that's coming out of your monthly budget for daycare, for car insurance, your phone bill, the groceries, the gas, your regular living expenses. And sometimes this may not be the best plan, but because we offer in this review several options, you'll be able to see that. The next thing that we're going to look at is how do they compare across the board on the rates and prices. These are copays. That's a set dollar amount that you're going to do when you visit your doctor or your specialist. We do have deductibles on the RX, that's prescriptions, $1,000. So is that going to be the best plan if we have somebody who has a lot of medications? Maybe not. But again, this family, we've got 2 young children. They're in school. They're active. They're probably doing all sorts of things, which can put them into the doctor's or I don't feel good or I've had an accident. So we want to make sure we're going to be covering those things. Generic drugs, we have prices on those. And you can also always use GoodRx. Laboratory outpatient. This is one that I would rather see a copay. However, this is a percentage after the deductible. So if somebody is sick and they do need to have a blood test, you will be spending, as long as you are in network, the negotiated rate, but sometimes that can be as high as $1,000 or more because you have to reach this number first. So usually in my quotes, there will always be a plan that has a copay for the blood test. I will always include that. In this quick example, I did not search further. Emergency room, 50% after deductible, $500 after deductible, and 25%. So this has a copay after the deductible. These have percentages. Urgent care, they all have urgent care. And then remember I told you the insurance is going to do their share of cost after deductible. Again, this is the deductible up here. 50%, the insurance is going to pay 50% of the bill until you meet your max out of pocket. Notice this one is much lower, but again, your monthly budget is much higher. 50%, 50%. This one, you're only paying 25% and your insurance company is paying 75%, a much bigger amount. So a family who knows that they have reasons to see doctors often, they have reasons to do maintenance blood checks often, this still could be the better plan for them, even though it is the more expensive plan. So this is just, again, a sample of what your personalized video is going to look like. If you are in that area where you do not get those subsidies and we are paying full price, I will then bring to the table the private insurance carriers that are major medical, PPOs, and they are compliant with all rules required through the ACA marketplace, such as the free maintenance visits, the wellness visits. Those will be included. They're going to have your copays. They're going to have a max out of pocket, a deductible, as well as mental health coverage. So those are all requirements to meet compliancy on an ACA plan. And I say ACA, that's Affordable Care Act, previously known as Obamacare. And that's this page right here. If you are not wanting to share your private information of birth dates and income, there is a place on the website that says, no, I don't want to answer those questions. Please send me the link so that I can run my own quote. You will be receiving a link to the page that's going to look just like this. You'll add your zip code. Pay attention to whether you need to choose a county or not. And let's just go ahead and check something out real quick. Does it change the prices on the county? So 1649, sometimes it does and sometimes it doesn't. And sometimes it changes even the carriers that are available. Yeah. So in this area, we are looking at different carriers, same zip code, different county. So it is very important, remember, to share your county that you reside in.